Hello, I'm Dr. Paul, and today we're going to talk about Candida or yeast overgrowth. So what does Candida or yeast overgrowth even mean? In the GI tract, it's normal to have small amounts of yeast as part of a healthy microbiome. The microbiome is essentially a collection of all the microbes in large intestine or colon. There are several forms of yeast like Candida, Rhodotorula, Geotrichum, and many more. Candida by far being the most famous of all forms of yeast. Sometimes the Candida or yeast can grow significantly to the point where it starts creating inflammation and symptoms. So what are some of the common symptoms associated with Candida or yeast overgrowth? Some common symptoms include gas or bloating, acid reflux, constipation or diarrhea, IBS or irritable bowel syndrome, fungal growth on your nail beds or on the skin, athlete's foot, eczema, acne, psoriasis, or other skin conditions, anxiety or panic attacks, autoimmunity, brain fog, sugar cravings, weight gain or weight loss resistance, recurring yeast infections, and more. So what are the causes of Candida or yeast overgrowth? Some common causes include antibiotic use, low beneficial flora or bacteria. These are essentially the good microbes in your gut, like your probiotics, a processed diet over time, chronic stress, hormonal imbalance, weakened immune system, excessive alcohol intake, and more. So how do you know if you have Candida or yeast overgrowth? Test, don't guess is our suggestion. There are a few different ways that practitioners are testing for Candida or yeast, which include stool testing, organic acids testing, and blood testing for Candida antibodies. Our preference is a 3-day stool test to look for the DNA of the Candida and other forms of yeast. If you have Candida or yeast overgrowth, what can be done to help? There are 4 major factors when it comes to getting rid of Candida or yeast overgrowth. Number 1, don't feed the Candida or yeast what it wants and thrives off of, which is sugar or anything that breaks down into sugar. Number 2, make sure to have optimal levels of beneficial bacteria, like probiotics, to resist and push back against the Candida or yeast. This information can be revealed in a stool test. Number 3, maintain consistent bowel movements and try to avoid constipation as much as possible to make sure the body is consistently getting rid of these unwanted microbes and toxins. And number 4, use specific herbs to try and target and eliminate the Candida and yeast. In terms of what herbs to use, this is where testing can be very useful, and make sure to always ask your healthcare practitioner about what might be the best choice for you. We always recommend confirming that yeast is present through testing instead of guessing. If the testing doesn't specifically tell you what herbs to use in your case, is there another supplement you can use to address Candida or yeast overgrowth? Candida Support is a broad spectrum supplement that we suggest most to address Candida or yeast overgrowth. Candida Support is a product that provides a blend of nutrients, potent botanicals, and essential oils to promote healthy microbial balance and immune support. Formulated for the goal of building a healthy gastrointestinal flora, this product includes biotin, a nutrient that inhibits yeast from converting into the more aggressive fungal form. In addition, sodium capryllate is included to disrupt the metabolism of Candida and create a hostile environment for colonization. Well, I hope you learned a little bit about Candida and yeast overgrowth, some common testing that's used today, and some things that you can do about it. Until next time, I'm Dr. Paul.